Welcome back to Combined by Alanna. Today, I'm sitting down with Dr. Jessica Shepard. Dr. Shepard is a registered OBGYN. She has her own holistic practice in Dallas. She is a go-to health expert on countless networks. She does a ton. Something I love about Dr. Shepard is that she's trained in Western medicine, but she has a holistic practice. She believes in a world where Western and Eastern medicine can coexist, as do I. Something Dr. Shepard and I initially connected on is that small behavioral and lifestyle changes lead to huge results, and that food can be seen as medicine. In this episode, we talk about women's health issues, and we really work in a chronological order because I know that many of you are either 20-something, 30-something, 40-something, 50, 60, whatever age you are, your issue or concern will be covered in this episode by Dr. Shepard because she knows about all of it. And she has a book coming out in October that's all about menopause. And for a bonus episode with Dr. Shepard, check out my Patreon, which is right down in the show notes. So without further ado, here's my episode with Dr. Jessica Shepard. Dr. Shepard, welcome to Combined by Alanna.
I am so excited to be here. I feel like we've planned this for some time now.
Forever.
And now it's here. We're here.
I know, we're here. I'm so happy to be here with you. We're like we're always talking on Instagram or something somehow. I'm so happy that finally here and
I know,
we're doing it.
I find like nowadays, just in the age of social media, like you really know so many people,
I know,
but then you don't know them in person, but you do know them. You're like, I know you, I know what you like. I know we've spoken so many times. Yeah. So like when we met today, it was just kind of like really nice to be in person.
I know. No, it feels like we've already done this.
Yeah.
Which is so funny. It's that parasocial relationship, but it's a really cool world. Mm-hmm. So I'm so happy that we know each other.
Yeah.
And it's so great. You're the go-to women's health expert. I'm so grateful that you're here.
I am glad I'm here as well, because I think really, like, even though I've been, trained as an OBGYN and done women's health for so long, I really am so glad to see it on the forefront that it is right now, and how we're able to discuss women's health without it being so taboo.
Totally. Mm-hmm. No, I totally agree. It's a great thing. There's also so much information. And so like, I have so many questions for you. Let's because go. I mean, I talk to women ages 20 something to 60 something. Mm-hmm. So I would love to have you just streamline a lot of the confusion, a lot of just all of the information that's out there. Yeah. Just hear from you, like, as such a good go-to resource.
I'm going to be your
these things.
Your pincushion. Go ahead.
I love
Give me all the questions.
First of all, you do so many things all at once.
Tell me about it. It's funny. It's like I do the thing. I'm just like in it and I do it. And then I look back and I'm like, oh, that was kind of a lot of stuff.
Oh yeah.
But I just like, one, I love what I do. Mm-hmm. And so to me, it's not really like all the things that I'm doing are so arduous and like painstaking, and and that's because I really just love what I do.
How do you stay grounded?
I think I stay grounded by who I allow myself to be surrounded by. And I don't mean that in a kind of way where I don't allow people to be around me, but the people that I allow to be around me and absorb their energy, or allow to feel in safe spaces when maybe I'm not in my best moment. Yeah. I've done a really good job at keeping a core set of people around me. So obviously there's my family. I have an amazing husband who allows me to be the me that I am, which is very busy. But I also have a key group of friends who I can just be me, right?
It's so important.
And I think it is easy to get drawn into the limelight of the amazing people that I'm around and how many people that I'm around. Yeah. And I really know when I need to be, one, by myself. Alone time is very helpful to stay grounded. And then two, the people that you surround yourself, that you really allow them to be there for you.
Yeah, I think that's so funny. I was talking about this with a friend last night. Mm-hmm. As you get older too, like I just turned 30. And
she just turned 30, everybody.
But you do start to realize like those energy vampires.
Yeah.
Is the word we were talking.
It's a real thing.
It's a real thing. Yeah. And like who gives you energy too. And I'm like that too, where I'm an introvert. Mm-hmm. And that just simply means you're getting energy by being alone.
Yeah.
And then you can go put your energy back out into the universe, and you're such a like amazing example of that. If you're,
I love to give back. That's how I see it, is from the information and the knowledge that I've gained over the years. I like to give that back. And I think it doesn't help me to keep it all to myself, right?
No, I mean, it shows, because you really do you do share so much information, education. You have a platform dedicated. You have a separate platform aside from your platform already dedicated to menopause, just providing more information about that. And that's something I definitely want to get into, because I mean, you're the person to talk to about that always. As a classically trained doctor in the Western world, how did you choose to open up a holistic practice?
Yeah, I think that was over time. I think experience also allows you to see the things that are new, innovative, and then also to look back on your path and saying, oh, what are some ways that I can expand what I've done up until this point? And I think the amount of years that I spent learning medicine, and really I did academics for 15 years and did a lot of surgeries and saw a lot of patients. What I really realized is I wanted to be able to spend more intentional time with them. And that was hard to do in the traditional setting. But I also had a background from my undergrad was exercise physiology. So I always had this like keen awareness of the body and how the body works and how it moves and how people can really fine tune some of the things that their body can accomplish if they kind of like tune into it. And I think that comes from then the Eastern philosophy of meditation, or using modalities such as acupuncture or vibrational sound bath and yoga. And so I said, what better way could I give back to my patients than giving them, again, the information on things that they could do to improve their quality of life or decrease pain or overall mindfulness and emotional health, outside of the things that I could give them in Western medicine, which is, I know you have a disease state or you came to me with an issue and I know how to fix that. What are the other things that I can implement into your life through Eastern modalities and treatments that can overall improve your quality of life?
You're also treating the root cause, not just the symptom. And
that's the beauty of it is there are some people who, I get them when they have the symptom. Right. And so it really is imperative for me to be able to use evidence-based medicine and use the modalities and the medications and the ways to help them not be close to death or to continue in that path where they're just always sick. But what are the other things that I can give them? The things that they can do through nutrition, movement, and then some of the other modalities that we explained before.
Yeah, totally. So it's interesting. I think a lot of women are better at advocating for themselves in the medical space, and a lot of men are pretty passive about it. Why do you think that is?
I think it comes with over time that there was a time where that wasn't the case. And I think that there had to be some pushback and really voicing the desire to do what we needed to do. And when I say that from the physician standpoint. Now, from a patient standpoint, I think that women are more complex. I think that women always want to know the detail. I mean, that even goes outside of medicine. True. And I think that just shows through when it has to do with health. It's not just, oh, well, something's wrong, I'll just push it away. It's, oh, something is different. I need to know why, what caused this, how can I fix it, right? And then I come all the ways. So that portion, or that natural curiosity of a woman, or the detailed portion of a woman, I think comes through in various ways in one's life, whether it's from the patient trying to figure out what's going on, or for a woman or a female physician trying to dig a little bit deeper into helping their patient. Yeah,
we definitely see that, like, kind of going back to the social media of it all. And maybe this is my algorithm, right? Like, a lot of health and wellness influencers, educators, whatever you want to call them, are women. I think it's an amazing thing, because I think there's a lot of women wanting to help other women. Yeah. And there's I try to see mostly the positivity of it all. Because of course, we could talk about both sides of anything, but I think it is important, because women, like you just said, are so complex that we all need to hear each other's stories, and that we all should. You can learn something from somebody else.
I think connection is one of the ways that we're able to express ourselves, and women love being able to be connected to other people's stories or other people's journeys. And so sharing more of those stories really allow us to see ourselves in others. And that can help facilitate the process of growth, or getting the help that you need, or answering the question that you need, and kind of like propelling ourselves forward.
Totally. I do want to talk about hormones, because I think a lot of women, and a lot of men too, are confused about hormones. And there's a lot of talk about hormone testing, which hormones to get tested, what to look out for, how the frequency of testing. Can you talk about that a little bit? Because I think it's confusing.
Yeah, it is confusing. And that's why I like to start with the fundamental basics of hormones. Hormones are like chemical messengers within our bodies, right? And so the goal of a hormone is to be released from wherever it's released from. There's multiple places it can be released from in the body. And what it's trying to do is communicate with a specific organ or a chemical pathway in order to get something done. And so it's kind of like this beautiful orchestra that our body is, right? And it's always talking to each other, and it's like, hey, what are you doing over there? And shout out over there. And when you have disruption of those chemical pathways, and the disruption can come from many things. It can come from, if you're ill, it can come from aging. It can come from if you have a surgery, a use of a medication, certain toxins, environmental toxins, food. So, I mean, the list goes on and on of what can disrupt hormones. The body, however, has another nice way of getting that hormone disruption back into homeostasis, right? Because it's not like we're walking around in perfection and then like one thing just throws it all off and it's all over. There's constant daily things that, either disrupt our hormones or threaten to disrupt them. And then the body really has a good way of like kind of pushing back on it and getting it back to where it needs to be. So over time, whether that's with aging or you have something that happens to your body, is that disruption may become a little bit more permanent than it kind of fluctuating back to the normal homeostasis that it likes to be in. And so when we talk about hormones, I always like to give that fundamental foundation on it, because it's not like it's ever just going to be one hormone. It's like the neighborhood, right? Yeah. And so when one house in the neighborhood is off, it kind of like sets all the other ones off as well.
Like
right?
the real estate.
Yeah. And so I think, that's why if someone, for me, I'll give a example. If someone has bleeding issues, like they have irregular cycles, or one's really late, or one's always early all the time, or you have too many cycles in 1 month, a lot of times we'll, look at reproductive hormones, but there's so many other hormones that we can look at as well, such as thyroid, because if thyroid's off, it can throw the reproductive hormones off, which gives you then the cycle issue, right? So a lot of times it can be in the path of that something else is wrong, and you're just trying to follow the path of fixing what needs to be done. And so that's why they are confusing, because there's multiple things that can set it off. It can be set off at a certain time frame in your life by a certain disease process. But what we're seeing on our end is we're like, okay, now you have a symptom. We're trying to help normalize that, which can be sometimes difficult to pinpoint and then also to fix. And then for my patients, what I try to tell them is that's why I really focus on the Eastern modality, is like there's so many things that can actually help your hormones stay balanced through what you eat, through making sure you exercise. And so that's kind of like this continuum and where I really like patients to see themselves. That's the holistic part of it. It's not just my hormones should be perfect, and when they're out of commission, I'm going to go see a doctor. It's my hormones may have bad days, good days, but I want to create this environment for them as much as I can where they're stabilized and they're fluctuating within this nice maintenance level. And so that's really the basics of hormones, how they respond, how I respond to my patients when they have something happen to them. And for women, we do have a lot more reproductive hormones than say males do. And so that's why some of our issues are a little bit more complex than you would see in a male, is because we have a lot more going on.
Yeah. That we definitely do. Are there certain hormones at certain ages that one should pay more attention to?
Yeah, I like to look at it stages and phases. I would say reproductive hormones just by themselves on their own. And when I mention those, I mean progesterone, estrogen, and testosterone. They kind of have like life cycles, like when one's really high and it's doing really well. And then obviously, you know, when you get to maybe your perimenopausal, menopausal phase, you start to see a decline in those reproductive hormones. And then come the symptoms with that, the signs and symptoms. And so I think that it's more important to pay attention to what's the norm of someone's body and when it's starting to fluctuate out of that norm. Okay. And then it's easier to address it that way. Obviously, during your reproductive years, just biologically, your body during your adolescence, when you get your cycle, into your 20s and 30s, your body actually is in default. It's like, let's get pregnant. That's what it's like. That's what we're here for. That's what we're trying to do. And so whether you get pregnant or not, or you're not trying to have kids or you do have kids, that's the prime time at which your body is like, let's do this thing. Mm-hmm. And then when you get into your 40th decade, your body biologically, okay, in a physiologic manner is like, oh, thanks so much for showing up. We're kind of like peacing out now. And so that's why you start to see the decline in the estrogen, is because it's like, I did my thing that I was set up to do. Mm-hmm. And now I'm going to go night-night. And that's what it's doing throughout its 40th decade. So now at this point in where we are in society and life, we have pushed the parameters of aging in the sense that we live longer or we want to have kids longer. So our bodies haven't caught up to that, right? Our bodies are still doing... Yeah, I have babies in my teens, 20s, and 30s. And so that's I wouldn't call it a struggle. I would just say that we have advanced to a point where we do things differently, but our body's like, oh, I didn't realize that we were doing anything differently. So that goes into the fertility space of why we kind of have different messaging now than maybe we did in the 50s and the 40s and the 30s, because we're having kids later.
That's so interesting. Like, especially our bodies not catching up to the fact that we, you know, a lot of women are having kids later. What would it look like for our bodies to catch up? How can our bodies catch up to that?
Yeah, that's going to have to come through, some really significant biological changes, you know, and kind of like that DNA genome on how we could actually change that. That would take years to do. So in the meantime, what we do is we use innovation and technology to preserve our fertility, which is when we talk about egg freezing, at the time at which we know that our eggs are at their prime stage, which is before it was just kind of luck. We're like, well, you kind of waited long. I don't know, you might get pregnant or not. Now through innovation and technology, we're able to say, hey, let's take those eggs at the timestamp of in your 20s or your early 30s to hold them for future use. And so that's where we've kind of gotten into the point of technology and using advances in science to help preserve fertility.
What if somebody doesn't want to do egg freezing or they just haven't and they
haven't? Yeah. So I think that's where it really takes kind of this open conversation and understanding what your body is able to do, right? I kind of, you know, for my patients, I like to put it into lists of things that you can control and things that you can't. Biologically, no one really has any control on when it's the decline of estrogen is getting to a point where it's not going to elicit follicles. Healthy follicles are that, because we're looking for healthy follicles, and the ability for your for the follicle to be to meet with sperm in order to then get pregnant. And then not only that is to maintain the pregnancy, right? So, and see, there's this cascade of things that needs to happen. It's not just, oh, I have an egg. It's no, now you need the egg. You need to make sure it's a healthy egg. Then it has to make sure that it can meet sperm and like really the fertilization process is sustained. Then it also has to be a pregnancy that stays for the time to actually deliver, right? So that's, I think when we think of it kind of in like a one frame stage of, can I get pregnant? I don't think sometimes people realize the stages that have to be like you actually walk out with a baby, right?
Because there's
So
miscarriages.
there's miscarriages, or there could be, if you have any diabetes or hypertension along with aging, right? So aging is going to be that number one thing that's going to decrease your ability to do those steps that I just, discussed. And so it's really having those types of conversations early on rather than at the time where then it becomes you can't do anything. And that's why we've kind of pushed back those conversations into in your 30s, your early 30s, of being like, okay, I'm not necessarily telling you have to have a baby right now or tomorrow, but if you did want to push it back, what are some things that we can do now to increase your chances of being pregnant later? And then there are people who don't choose to do IVF or egg freezing. And they have to be realistic in the sense of, this is my body and this is what it can do. Are there holistic things that they can do to absolutely increase their chances of maintaining a healthy follicle reservoir, I guess you can call it. And I think that there are things you can do that through diet. You can do it through acupuncture. I love Eastern modalities to be able to do that. Now, I want people to truly understand that, again, those are not necessarily going to make it happen. It can improve your chances. And so being realistic in the entire conversation of this is probably the most important part. So I'd never want someone to go into that saying, she told me that I could get pregnant if I just did acupuncture and ate a different diet. And I'm like, no, I said that it could increase your chances. And so that's the most important part, is in that relationship when you're having a discussion with a healthcare provider. It's one that you're getting like total understanding of what the discussion is and what your chances are as an individual, and making sure that you're being realistic with that.
That makes sense. Especially, I've heard this, that people trying to get pregnant, it's like if you're trying too hard, it's not going to happen. So something like acupuncture probably, I would assume that it gets you out of that mindset.
Acupuncture, they have an actual real fundamental belief on what, because they're practicing medicine. And so they use the needles in the parts of the body where they know that they're going to, whether that's decrease inflammation, whether that's increase the likelihood of a follicle being released from the ovary. And so that's why I really rely on them to use the medicine that they use. And I firmly believe that even though we may not have a million research papers on it, I do believe that what they've been able to accomplish through acupuncture, say, and infertility is profound. And I would never take that away from someone to say, oh, no, don't get acupuncture, it's not going to work. Do I know the numbers at what it's going to work, or the actual percentage? Not necessarily. But I do think that it is a safe path for a patient to go down and navigate if they're looking for that to be their way that they would want to address infertility.
Yeah, it's not too invasive. Switching gears a bit, what are your thoughts on cycle syncing? Such a hot topic.
Yeah, it is a hot topic. So cycle syncing, that's when I I always go into like my Western medicine vault and saying, okay, what's the science behind this? What has been done in the format of a study, and what are some of the numbers? There's not a ton of studies on cycle syncing. I think cycle syncing can be done when it's done well, and really diving into the things that need to be done in order to accomplish it. And so I do really believe that those modalities, you can't half-ass it.
Yeah.
Right? And so if you're going to do it, then do it.
Yeah.
And really lean into it. At the end of the day, I always say these are safe modalities for people to do. Will it always work for everybody? No. But I could say that the same about some medications that I give, that they don't work the best for somebody. So I think if you look at it at a scientific evidence-based, that's probably something that a lot of doctors maybe don't recommend, or and it's not that they don't recommend it because they think it's bad. It's just that we don't know enough about it to give really good validating percentages and statistics about it. For people who do it and do it well, I know that they have great outcomes, right?
Really?
But they have to be willing to do the thing.
Yeah.
Yeah.
Why has it become so popular?
I think it's become more popular because, and this is again what you see in kind of waves in medicine, is we are kind of in a phase where people don't necessarily want to take as many medications. They want to find a holistic way of going through a process than having to do it just definitively. I have this thing and you get a medication. And so those are ways to navigate through a process and saying, what can I do on my end as an individual to potentiate or help a situation? And cycle syncing is one of those.
That makes sense. And people like rules and guidelines a bit. So
yeah. And when my patients ask about it, I can never really give like hardcore information on how to do it. What are the best ways to do it?
Right.
But I would never say, don't you do that.
Yeah.
Right. So I think there needs to be this kind of like back and forth about it in a way that's respectful. But I would never shoot someone down for saying that they're going to cycle sync.
Yeah. No, I think it's worth trying. I mean, especially with diet, again, another, not always, but a non-invasive
yeah. And you have to be willing to commit to it.
Yes.
And I would say for me, for all aspects of medicine, behavior modification and trying new routines and habits is probably the hardest part. I mean, I tell patients every day, like from their nutrition standpoint, I'm like, these are the things that we probably shouldn't be eating.
Yeah.
Or I have a lot of patients who are like, I eat healthy. And then I will sit with them, go through kind of like a kind of short food journal. And then by the end, I'm like,
is it a lot of processed foods?
A lot of processed foods, a lot of like food groups that I'm like, I don't think that one was in the healthy food. And I try not to polarize food like healthy, unhealthy. Yeah. But I like to look at it as like holistically, what does your food plan look like? And what's your relationship with food? Yeah. So I don't think that we used to be like this you cannot eat fried foods. I now say, how about we limit how much fried foods you're eating? I don't think they're going to be great for you if you eat it every day. Yep. Right. And so I think the psychology of food and the food relationship that we have in America is toxic. And we live in a diet culture which is restrictive and nothing sustainable. Yeah. My goal is that the way that you eat now is the same way that you eat in your 70s and 80s. But if you look at it in broad scope, it is overall healthy. But again, that requires making sure that we're eating fruits and vegetables, but not necessarily processed, right? I want you to be able to understand food and understand the benefit of it and what things are really going to be beneficial for you. And that requires really having a better relationship with food and understanding what food is good for you and what is not going to help you in the best way. I want people to take kind of steps back and saying, how can I collectively put all of this together and make it overall healthy for me in my journey? Yeah. And not feel so like victimized or that it's I don't know. The whole food culture to me is just it's toxic.
No, it's tough. Toxic. And it's funny. You and I connect on also like food as medicine, and that food can make you feel good. It can taste good. It can, they can coexist. Yeah. It's a tough world out there with food.
And then also, if you think about like what food is usually available for people when we think of just our lives and how busy we are, most food that's readily available for us is not the healthiest. So again, that takes someone to have to take a step back and saying, you know what, I'm going to have to make the food that is good for me more readily available, meaning I'm either going to have to make it myself, or I'm going to have to go to the source where it is the food that I should be eating. Yeah. Right. And so that takes extra steps. It takes changes in routines and habits. And that's not always easy.
No, that's why it's funny. That's why I started my company as a prepared meal service, because the best way to reel people in is food, but the point was really to say food again, can taste good and can make you feel good. And then I'll teach you about food combining and then I'll teach you about what I do, what's worked for me. There's a lot of talk about also birth control right now. I went off of birth control 3 years ago, I guess now. And a lot of women, I think, are learning about the side effects of birth control and what it does to them. And, even back to the fertility issue, how it could mask a potential fertility issue that you don't know that you have until you get to that point. And a lot of women that I talk to are confused about why they went on it in the first place or why they were put on it in the first place. Can you talk about that a bit? I'm curious.
Yeah, I take it a step back and kind of in the day and age that we're in. So as an OBGYN, obviously that's a big part of our practice is contraceptive care. I always started the conversation of, as a woman, especially in this day and age in 2024, the fact that I feel that we are back 50 years when we think about reproductive justice. Yeah. I put that in context because the reason why contraception in the 40s was made is because we had no choice, right? Mm-hmm. And so the reason why I say that is not to say that people have to be on birth control, but I always want to make sure that people understand that we're not taking it, we're not understanding the importance of it.
Yeah. And now a brief word from our sponsor. It's me. I'm the sponsor. And I wanted to tell you about the Combined by Alanna Patreon because for $10 a month, you are getting weekly meal plans to follow with recipes and grocery lists, personalized mini consults with me where you can tell me all about your gut health, bonus content from all of the interviews that I'm doing. You'll also get access to the Combined by Alanna community board, early access to IRL events and virtual events, not to mention 50% off my 3-day food combining challenge ebook and 30% off of all Combined by Alanna merch. And trust me, there's plenty more to come. Now let's get back to the episode.
Because if people want to stay on it, they shouldn't be shamed. And if people don't want to take it, they shouldn't be shamed either. But when you look at the fundamental, like beginning stages of birth, we had nothing. And so we didn't have the access. We didn't have the information. So to me, the ability for a woman to take something to give herself the choice and option not to get pregnant is where I always say, look from where we started. And that is the reason. Was it perfect? No. Did it help? Absolutely. Did it give women freedom from not having to have 10, 12 kids? Yes. And I think I always start there. Then moving into where we are now in 2024 is from then, one, we've changed the formulation of birth control pills significantly. It didn't have as much estrogen as it did back then. We have some who only have progesterone. We have different variations of how much estrogen is in a birth control pill. We have an injection. We have an implantable. We have a ring. We have an IUD. So like now we've progressed into choices. And so I try not to polarize it because I have so many patients when I ask, well, why do you want to be off birth control? Which my goal is not to say that you can't. But the answer usually is, oh, well, I heard it's bad for you. I'm like, well, what type? And then that's when I realized that the full conversation hasn't been had. And that's my job. My job is to make sure as you're making a decision, you have all the education behind it before you're just going to be like, I'm going to stop birth control.
Yeah.
And I'm like, okay, do you have any other issues when you are off birth control? And some people do. And that's why they were put on it.
Right.
Or some people were like, well, at that time, now that I think about it, I was trying to prevent pregnancy. Okay, great. Maybe you're not doing that now. And so that's all I would say about the birth control thing is that I think more people do want to come off of it. I think that there are some side effects that people felt. I don't think we had the best conversations about it. We would just be like, oh, we'll stay on it, which is not an option because you're just saying stay on it. But I do really believe that the conversation behind it needs to be very robust before we're just saying, I want to be off birth control because it has helped a lot of women. And so I don't want to polarize the conversation and being like, well, birth control is bad. I'm like, well, look where we came from.
You're right.
We had nothing. And it's either you're pregnant or you're not. And no one cared.
Yeah.
And no one had a voice for women to being like, I just want to make a choice for myself. It was like, well, your only choice is you're pregnant or you're not.
I totally. No, I think.
And so now
we're
in a better part in society where we have more options to come off. And I think that there are very valid side effects that people have, but then there's a lot of people that don't, right? There's a lot of people who are on it. They're like, I'm doing great.
Right.
And this is really good for me. And I like the option it gives for me to not have to get pregnant. And so the better question I would say is for those who want to come off, have you had that full conversation about why? What have you taken in the past? Why were you on it in the beginning? Has that changed? What other options have you tried? And making sure that you have this like really good understanding of what you want to do and why, and having the relationship and someone to advocate for you, to being like, I totally understand what you're saying. Let's take you off.
Now it's interesting because I was put on it in 8th grade for terrible cramps. And I went off of it and, you know, didn't get my period for 9 months, took progesterone pill, just simply so I wouldn't get that buildup of tissue. And then got my period. Now I'm back to a natural one, but it's funny, I'm back to like that 8th grade horrible cramping. And to me, I'm like, okay, it's a hormone imbalance. And I'd rather go get that solved instead of going on the pill or like the ring or anything. And just, you know, kind of to me putting a Band-Aid on it.
Well, I would question you too.
Yeah.
Why do you think you have a hormone imbalance?
I don't know.
See
I don't know.
I'm like,
no, but you're right.
These are the questions.
Yeah.
So you said it, and that's exactly what I say to my patients. I'm like, that's a fair statement because that's what you feel, but why do you think that?
Yeah. I think literally just because of the bad cramping.
Because you have cramping.
Yeah. And I don't know why. I mean, that's why I'm talking to you. I'm like,
right. So
you
cramping, and that's why the body has a way of telling us things, right?
Right.
And so when people have cramping, there's various reasons. One, it's part of hormone release, right?
Yeah.
So the chemical that's released when you're having your period and you're cramping is prostaglandins, which create inflammation and pain. But it's a normal part of the process, right?
Even if it's like excruciating.
So that's when you'd say to your doctor, it's excruciating. Could it something else be off? Like maybe I have endometriosis.
Yeah.
But I also then put into the conversation about pain, right? So I don't want people to be in pain, but some way that's the way the body's talking to us, and how we mitigate pain in the Western world is different than how we address pain in, say, Eastern cultures. So it's a very dynamic conversation about pain because I can never tell you your pain's not excruciating because you're the one having the pain, right? So pain is very subjective. What I think we haven't done in the Western world is help us understand pain, how to mitigate pain, because we live in a very world where if you have pain, you take meds. So we have created this now pathway of if I have pain, I have to take meds because I should feel no pain.
Right.
And we haven't learned ways to process pain differently than telling ourselves, I have pain, I shouldn't have it, I need to take something. So the brain is very, very smart, which is why it's the brain.
Yeah.
But if we create those pathways of I have pain, I need to take something, I shouldn't have pain, then that's the pathway that we create, right?
Yeah.
But there are different ways to mitigate pain. Again, breathing exercises, mindfulness, different foods that we eat, acupuncture, yoga, right? Because if we can talk to our body through different ways and modalities that are natural, sometimes you can actually mitigate pain. And there's a lot of research behind this, but behind the neurology of pain and how you can mitigate pain outside of the whole pain medication thing, is how we can use our brain to decrease pain. But we're not taught that. Right. And so that's, again, a lot of what you see in Eastern philosophy, but in the Western world, we are very boom, boom, boom. I have pain. I shouldn't feel pain. I need a pain med. And so we just loop that cycle.
Totally.
Right. So again, it's not dismissing your pain.
Yeah.
It's how do I teach my patients to have a better understanding of pain, what it is, how am I feeling right now? What are some ways that I can use some holistic, natural ways to minimize pain?
Yeah.
And looking at it from that approach, then it's something that's completely bad. Because sometimes it is. It's a disease. It can be a disease process, but it doesn't always have to be. And that's the other part of the conversation.
That's something I love about you. But by the way, really, this is like summed up because you are trained in a Western way and you believe in an Eastern approach, not really but and. Yeah. And I think that's awesome.
I feel like I have to, because the path at which, I was taught really is only one way. Yeah. And so it is a hammer nail approach, right? I have pain, I'm going to give you pain meds, smack. I have this, I'm going to give you medication, smack. That's a very one tool approach. And so if I'm able to give to my patients all these other modalities, behavior modification, other Eastern modalities to get through life, whether it's through a pain issue, infertility issue, whatever it is, then all of us will do better. But is it an easy conversation? No. No, because we haven't been taught that.
No, and everyone likes a quick fix as well.
We sure do. We want our drive-through by the second window. It better be there.
Yeah, no, it is. And it's like whack-a-mole. It's
Right.
another one.
And so we have fed into that. Like the whole system is fed into it, right?
Yeah.
You go to the emergency room because, even having worked in the emergency room when I was on rotations, the amount of things that people would come into the emergency room for, I was like, oh, wait, I thought it was an emergency room. As in, is this
It's an emergency.
Is this an emergency? Right? But we've
Oh,
created this environment. And so now everyone's just playing their role in the environment. And so to now like kind of stick something in there and being like, hey, try this. They're like, whatever, we're already doing our routine. Get out of here.
Oh my gosh. That is so crazy. I can't imagine what you saw in there.
Oh, yeah. You wouldn't believe it.
I wanted to talk about perimenopause and menopause because a lot of my one-on-one clients that I health coach are going through perimenopause or menopause, and they're, talking about how things are slowing down and how they're just not feeling like themselves all of a sudden. They're having a whole host of symptoms. How can women be proactive when it comes to menopause?
Yes, being proactive that's why I love being able to educate. Do the thing that you're like, you do all this education. I'm like, because I have to. There's so many different things that I think people misunderstand, right?
Yeah.
There's miseducation of what's going on. I think that as they're going through that process, they don't know that the process takes so long, right? People think that perimenopause is maybe just the latter portion of their 40s or maybe just go through the year and then they're menopausal. But what we now have realized, and we've known for some time, but really like looking into the science of women's health and perimenopause, that can last anywhere from 7 to 11 years. So for me to think that you are going to be able to get over that in a day is not realistic. But I would want that people can create different routines for themselves over the 7 to 10 years. So as they're getting into menopause, they're adjusting with their body, right? So as things start to change, they're like, I need to tweak some of this. I need to do a little bit more of this. I think that as estrogen, and I call it the wonder drug, starts to decline over those 7 to 11 years, that's where you start to see, remember we were talking about just how we started. This is like a perfect ending to how we started. Those chemical messengers and how everything is talking to one another, right? And so it's in homeostasis, right?
Yeah.
And so as you start to like kind of the estrogen's like, oh no, I'm not showing up today, or I'm going to take a few days off, or then everything domino effect starts to be impacted as well. And so that's why we start to see some of the outcomes of decrease from estrogen being weight, right? Because now our muscle mass is decreasing because there's estrogen receptors all over our body. It's not just in the pelvis. And so if the estrogen receptors on your muscle are not being able to respond to estrogen because there's less of it, as you start to see muscle mass decrease. But muscle is the biggest utilizer of glucose. So if you're using your source of your energy source through your food of glucose and you're feeding it glucose, but nothing's taking it up, and the glucose sits, then the liver's like, hey, I store glucose here, but now there's just too much, right? So the liver's like, I can't take any more. And then what does glucose do when it sits too long? It turns into fat, right? And so it's all those little steps that start to happen. So it's never just like one thing. It's the communication. It's all these different messengers that don't have everything that they used to have, and they start to offset as well.
Yeah. I also am wondering, so every individual is so different, as you know. There's no one size fits all treatment to something, but what is one thing that you would tell women across the board to do?
Yeah.
Or not do?
How about I tell you 3 things?
Yeah. Please.
I would say, are you talking about through perimenopausal phase?
Yeah.
I would say in the perimenopausal menopausal phase is the 3 things that I would say are going to kind of help you in your path. Again, they're helpful. I'm not saying you have to do them, but I would highly recommend is hormone replacement therapy. So not everyone can take it, but a lot of people who can take it think they can't, right? So that's, again, expanding that conversation on who it's good for. Hormone replacement therapy in the form of estrogen, progesterone, and testosterone, right? And those can be a variety of all of them or maybe just one of them. And that's why you need to talk to your doctor about what that would look like if you take it. The nutrition is imperative. It's such a pillar of health that we often neglect. And nutrition is such a big part of health and the components of how we can show up for ourselves and biologically what our cells can respond to. And that changes over our decades, right? And so in your 40s and 50s, remember we talked about muscle mass and then glucose hanging out. So that's why I'm saying protein intake needs to be completely shifted and increased into your 40s and 50s.
Animal protein.
I will say we could get in a whole protein debate. I think that there are more complete amino acids within animal protein.
Okay.
For those who choose not to eat animal products and are only plant-based, you can get a really robust amount of protein out of your plants, but you just have to be very intentional with it.
Yeah.
They don't have as many amino acids, but you can still get a really good amount of protein. But that protein amount needs to increase significantly during that phase. Then the last thing I would say is exercise. Like, I think exercise is so important. And it doesn't necessarily mean that I expect everyone to be a triathlete.
Yeah.
The goal is, how am I moving my body? How am I making sure that I'm increasing weight training or weight bearing activity to support my bones? But just in general, my daily movement. We are a very sedentary society. Yes. And so the older you get, the more likely you are to be sedentary, which is only going to then cascade into, we talked about. So now you're not moving your muscles. The glucose can't be utilized. Your heart is like, I'm not going to work as hard anymore because you're not really doing anything. Yeah. And so again, then your body starts to do the thing because you're not doing it for it. Right. So we want our bodies to show up for us in like our 70s, and your body's like, what have you done for me?
Yeah.
What have you like given to me over these years that you just want me to show up for you?
That's
so it's an
funny.
investment. I think that health is an investment. And I would never tell anyone from like a financial perspective, okay, when you retire, then start saving. No, we tell everyone to start saving for retirement from before.
Yes.
So it's the same thing with your health. How do you want to show up in your life in your 70s and 80s and possibly 90s? Yeah. The work has to be done right now.
I do have a question about what you said about the protein intake. It's my understanding that as women, from a biological standpoint, like our livers are smaller, meaning that by having more animal protein, it can almost overwhelm the liver, and then it allows for less movement.
I think that's a great conversation to have, because there is this kind of like controversy around protein, animal protein, plant protein, women versus men. But when you look at the dietary recommendations that are made on protein for women, they're actually very minimal, and we don't actually have the recommendation for what we actually need. And so I don't think there was a lot of study done in women in the perimenopausal, menopausal phase when they're decreasing estrogen and muscle mass is decreasing significantly. There has to be something there within the diet that's going to be that building block for muscle, right? So you have the severe sarcopenia occurring, and we're not really giving it what we need in order to build. Sarcopenia, I'm so glad you asked. Sarcopenia is when you have lean muscle loss. So you have muscle wasting rather than muscle building up, right?
Got it.
So when you have your muscle that's losing mass in your 40s and 50s because estrogen is decreasing, then you're not taking in protein, right? So it's kind of like, again, going back to that kind of equilibrium. We have all these things decreasing, which is going to be very helpful for your heart. Like protein or muscle mass is very important for your body and how it kind of, the mechanics of it. Yeah. And we're not implementing any protein, then your muscle can't build. Yeah. Right. The other thing that I would say about that kind of discussion is most times when we look at those studies, they're not putting it into context with movement or exercise. Right. Does that make sense? So you're not you're not using that actual energy and protein. Yeah. So it's more of like if you had a pig trough, right? And you're putting in all this food, there's no pigs. No one's eating anything. So now you're just like putting in all this stuff and no one's utilizing it. Right. So if you're not, that's why it has to be this balance of how am I moving my body in order to utilize the things that I'm putting into the body.
I see. On that note too, what do you say to people who also think that there's this crazy cortisol spike when you do high intensity workout or something. Because a lot of people believe that that comes with the whole protein thing. Yeah. It's almost like they go hand in hand.
So high intensity training and then also sprint interval training are really modalities to, depending on what type of muscle you're trying to activate. Is it slow twitch fibers? Is it fast twitch fibers? And we're really trying to use explosive amounts of movement in order to kind of get the muscle to kind of expend more energy.
Okay.
Does that make sense? And then also in addition to weight training, right?
Yeah.
And so that's why that has to be a significant part of how your movement changes and how your diet intake and recommendations change as you start to age, because your body is changing. The machine is changing. Yeah. And so if you don't accommodate to the changes in the machine, then the machine's like, well, I'm still running out here. I'm running out of steam and gas. Right. And you're not giving me the proper fuel that I need.
I see. No, I respect your viewpoint and your everything that you have to say. So I was curious about that.
But I still think Pilates is very important. I don't think you should stop. I think it should be this kind of interweaving of different types of workouts. But because we never really placed emphasis on weight training and weight bearing exercise for women, that's why I think you hear more about it now. It's because we were always told it was kind of like a male and female thing, which again, I have this whole thing with that. Women were going to do aerobics with their tight leotards and men were going to weight train. Yeah. And so now we're kind of breaking that rhythm of how women see themselves in a weight training, weight bearing exercise capacity.
Yeah. Yeah. My last question for you. What is the most misunderstood concept in women's health today?
I think the most understood concept is that women take a significant hit on their bodies during the menopausal phase that we have never really accounted for in studies. The ovary is one of those organs that just, for lack of a better term, like dies, like when it goes through menopause, because it's just not doing what it had done its, previous years, 50 years prior. But we never make the accommodations for what happens when estrogen decreases. And so what I would say is for anyone going through that phase is, one, I always like to change the kind of outlook on how people see menopause. I think if it were a screenplay, they would think it's a horror story. And I would prefer it to be a comedic love story. Is that we have this transition to really honor our bodies and honor it for the change that it's going through and be very thankful and grateful for the things that had done before. But in order to honor it, we need to accommodate for those things that it's going through and doing it in a graceful and loving way and not be so hard on it. Just being like, you know what, my body's going through a change and I can be so happy for what it's done for me and provided me with in the past, but I'm going to honor it now by giving it what it needs. Yeah. And I think that we need to change how society thinks of women and aging. I think you see it across the board, whether it's with the workforce and your career, relationships with your partner, and so many different aspects of life where as women start to age, it's kind of like we're cast away. And I really want that to change. And I think that can start internally with how people see and view themselves. Yeah.
I love that. No, you always hear your body is a temple, but it really is, especially for women. We do so much and we can do so much. And I love how empowering you are. And I really just appreciate that. And I think anyone listening is going to just be so excited from everything you have to say because you're amazing. You're awesome. I'm so happy that you're here with me and it's been a pleasure. So thank you.
Thank you for having me.
Oh, I really appreciate being here.
Yeah, absolutely.
You told me that you wanted and you love like a crunchy cold salad. So I made my vegan Cobb salad, which I love it.
So you tell me what's in there.
So it is, by the way, this is like my biggest hit.
Oh, good.
Truly. So it's romaine, radish for like the bitterness that really helps with the digestion. Fennel, same deal. Corn, it's summer almost. I love it. In my brain at least. Avocado, the tomatoes. Best healthy fat, plant-based fat you can have, tomato, and then the dressing is a coconut yogurt based dressing.
Ooh, I love that.
Yeah, Coco June,
really
which is my favorite.
I'm excited about this.
Yay. Oh, and then coconut, how could I forget this? Coconut bacon. Oh. So I've like taken coconut chips and recreated that smokiness that bacon has with just literally smoked paprika and a little bit of avocado oil.
Is that celery?
No, that's fennel.
That's
it's just
the
like
fennel?
Yeah, I love that part of the fennel.
Oh, I'm excited about this because I've never.
Yeah.
I don't think I've ever had fennel this way.
Oh, I love fennel. So good.
I'm so excited about this. I'm
Yay.
gonna go make everybody jealous.
Oh my God, I love that. I love it.
Thank you.
Absolutely. If anyone wants to go find you,
Yeah.
which I know everyone will, where can people
Yes.
find you and your book that's
Yes.
coming out?
So my book is coming out in October, which happens to be World Menopause Month. I'm so excited. It's really like a love letter to how I want women to see themselves throughout this journey. And I used a bevy of my colleagues and experts who are amazing in sexual health, who are amazing in bone health, who are amazing in exercise, and really utilizing their expertise in conjunction with mine. And then also taking stories from my patients and friends and having them form a community of their experiences through menopause. So Generation M is coming out in October. Awesome. But if people want to find me, Instagram is probably the best place. That's where we found each other.
I know.
It's Jessica Shepherd, MD, which, they can come to you and get that info.
Oh, yeah.
And then I did kind of take all my menopause information off of my main page, Jessica Shepherd, MD, and put it on Modern Meno, Meno. And all that is just menopause information. Because I really wanted people to just have that information when they need it in a time of need. And then they can also follow me on Jessica Shepherd, MD. Follow me on both.
Awesome.
Why not?
Follow both. I'm going to have both in the show notes, but I always learn something from your Instagram.
Thank you.
And you're just fun to follow, your stories and everything. So definitely
I like to make the stories fun.
They're fun. I love it. No, thank you. Thank you for coming
You're so
on.
welcome.